Psychosocial assessment and intervention, supporting patients and families. What is psychosocial assessments? The definition of the psychosocial assessment is a comprehensive evaluation of patients' emotional, social, and environmental factors that impact their physical and mental well-being. The psychosocial assessment identifies patient and family needs, guides intervention, and enhances quality of life. The components of the assessment include the patient's medical and psychological history, emotional and mental status, social support network, environmental factors, cultural and spiritual beliefs, and patient and family goals and values. There are several assessment tools for assessing the patient. Standardized questionnaires include the mini-mental state examination to evaluate cognitive function, the geriatric depression scale to assess symptoms of depression in older adults, clinical interviews with providers, observation of the patient, receiving family and caregiver feedback, and reviewing the patient's medical record. Psychosocial interventions may include counseling and therapy, support groups, referrals to community resources, family and caregiver support, and cultural and spiritual interventions. Regulations and guidelines. Hospice care providers must conduct a comprehensive assessment of each patient's needs, including psychosocial and spiritual needs. Social workers must be involved in the interdisciplinary care team and contribute to the development of the patient's care plan. Hospice care providers must provide counseling and support services to patients and their families, including psychosocial and spiritual support. Social workers must maintain accurate and complete records of patient interactions and services provided. Let's review some best practices. Establish a therapeutic relationship. Conduct comprehensive assessments. Develop individualized plans. Collaborate with interdisciplinary teams. Collaborate with a local community. Stay up to date with available programs and services, and continuously build a library of resources. Monitor progress and adjust plans as needed. Common psychosocial issues in hospice care include anxiety and fear, depression, grief and bereavement, trauma and PTSD, family conflict and dynamics, cultural and spiritual concerns, end-of-life decision-making, social isolation and loneliness, body image and self-esteem, loss and letting go. Patients feeling anxiety and fear may experience restlessness, agitation, pacing, difficulty sleeping or concentrating, worries about the future, fear of dying, physical symptoms like tremors, sweating, or rapid heartbeat. Intervention strategies you might want to try include providing emotional support and reassurance, teaching relaxation techniques, connecting patients with counseling or therapy services, helping patients develop coping strategies, and collaborating with interdisciplinary team to address concerns. Patients experiencing depression may feel sadness, hopelessness, or a loss of interest in activities. They may have changes in their appetite or in their sleeping patterns. They may feel fatigued or experience a lack of energy. They may express feelings of guilt, shame, or worthlessness. Here are some intervention strategies you may want to try for patients experiencing depression. Connect patients with support groups or online resources specific to them. Encourage self-care. Help patients engage in meaningful activities. Identify what interests them or sparks joy. Involve and include family and/or volunteers to co-create more meaningful moments. Collaborate with the interdisciplinary team to address concerns. Patients experiencing grief and bereavement may feel emotional distress, sadness or anger, have difficulty coping, experience changes in their behavior, mood, or relationships, or feel loneliness, isolation, and disconnection. Intervention strategies for individuals with feelings of grief and bereavement include providing bereavement counseling or support, connecting families with support groups or online resources, encouraging emotional expression, helping families develop coping strategies, connecting families with resources and services, identifying specific dates or events that may exacerbate their grief and schedule a call or a visit to check in. Patients experiencing trauma or PTSD may experience flashbacks, nightmares, or avoidance of triggers. They may feel hypervigilant, express an exaggerated startle response, have difficulty trusting others or forming relationships, experience feelings of shame, guilt, or self-blame. Intervention strategies you may try for patients experiencing PTSD or trauma include referring patients to trauma-focused counseling or therapy, connecting patients with support groups or online resources, helping patients develop coping strategies, communicating with the interdisciplinary team, and keeping the care team informed about any specific triggers of concern. Family conflict and dynamics may present as communication breakdowns or misunderstandings, emotional tension or conflict among family members, difficulty making decisions or agreeing on care plans, expressing feelings of resentment, anger, or frustration. Here are some intervention strategies for family dynamics. Provide family therapy. Connect families with conflict resolution resources. Encourage open communication. Identify all family members that the patient wishes to include in the care plan and communication chain. Create care conference opportunities and help facilitate difficult conversations. Cultural and spiritual concerns. Expressing concerns about spiritual or cultural traditions, difficulty finding meaning or purpose in life, seeking spiritual support or comfort, expressing feelings of guilt, shame, or regret. Intervention strategies for spiritual concerns. Encourage expression of spiritual beliefs. Help patients find meaning and purpose. Support patients in maintaining cultural or spiritual practices. Connect patient with cultural or spiritual resources. Identify opportunities to match team members who speak the same language and include them when possible to avoid a language barrier. Collaborate with a chaplain to honor the patient's individual spirituality. End-of-life decision-making. Patients may experience a difficulty making decisions about care or treatment, expressing concerns about quality of life or suffering, seeking information or support for end-of-life decisions, expressing feelings of uncertainty. Here are some intervention strategies for patients experiencing a difficult time with end-of-life decision-making. Facilitate advanced care planning and discussion. Support patients in making informed decisions. Help patients weigh their options. Connect patients with resources and services. Patients experiencing social isolation and loneliness may express feelings of loneliness or disconnection, have a difficulty maintaining social relationships, have limited social support or interaction, and express feelings of sadness, depression, or hopelessness. Intervention strategies for loneliness. Encourage connection with friends and family. Help patients engage in meaningful activities. Support patients in maintaining social connections. Offer to co-host a meaningful gathering. Body image and self-esteem. Expressing concerns about physical appearance or changes. Difficulty coping with disability or loss of independence. Expressing feelings of shame, guilt, or self-blame. Difficulty maintaining self-care or personal habits. Intervention strategies for patients experiencing a poor body image. Provide therapy to address body image concerns. Encourage self-care and self-compassion. Identify ways the team can provide support and include the home health aides and volunteers. Would the patient like a haircut or shave? Would the patient appreciate a new outfit that fits properly or feels better? Would the patient appreciate assistance with makeup application, a manicure, or hairstyling? Patients having trouble with loss and letting go. Expressing feelings of sadness, grief, or loss. Difficulty accepting the terminal illness or prognosis. Expressing concerns about leaving loved ones behind. Seeking support and comfort. Intervention strategies may include providing bereavement support, connecting families with support groups, encouraging expression of emotion and memories. Consider journaling, painting, or grief gardening. Grief is a natural response to loss, but it can also be a challenging and isolating experience. Psychosocial support from social workers and our interdisciplinary team can help our patients and those who love them navigate their grief and find ways to heal and move forward.